Hi, everybody. Thank you so much for joining us tonight. My name is Darylyn, and I am a member of the ReActiv8 team. We're really excited to have you here to learn more about chronic low back pain and the ReActiv8 restorative neurostimulation therapy. So tonight we're going to hear a physician presentation with Dr. Schott about chronic low back pain and treatment options and whether ReActiv8 might be the right next step for you. Then we will also get to hear from a real ReActiv8 patient. Her name is Rachel, and she's going to tell you about her journey with back pain and her recovery with ReActiv8. And then throughout the presentation, if you have questions, feel free to put them into the chat or into the Q&A, and we will answer all of those towards the end. All right, now without further ado, I would like to introduce Dr. Kathryn Schott. She is an anesthesiologist and pain management physician at Pain Consultants of East Tennessee, and she's going to give the presentation tonight. One second. I'm going to give her control of the presentation. All right, take it away, Dr. Schott.
Fantastic. Thank you, dear Lynn. And I first want to thank everybody for joining us tonight, taking time out of your busy schedules. We have several of you joining us, and I'm sure we'll have more trickle in over the course of the hour. But just thank you for taking the time, and thank you to dear Lynn again for coordinating this and the Main State Medical team. Thank you so much. And then Rachel, thank you so much for sharing your story so we can really get a patient's perspective on things. I've been with Pain Consultants of East Tennessee for a few years now. It's a very well-established practice, been here for about 30 years. And along with my partner and the leadership of Dr. James Chu, we really try to stay on the cutting edge of medicine with the most up-to-date evidence-based treatments. And tonight we're here to talk about one of those tools that many patients have needed and we're excited to offer. Darylyn, can you advance the slides? Oh, here we
It
go.
works.
There we go. All right, so tonight we're here to talk about chronic low back pain, and it's one of the most common reasons people see the doctor or miss work or school outside of things like infections. And it's one of the most challenging types of pain that we treat because it doesn't respond to typical treatments. So I'm guessing you're here tonight because you probably have chronic low back pain or someone you love has low back pain and you're here to learn more. And so just to start off with the chat function, if you could just type in how many days out of a year does chronic pain affect your life? So missing work, school, vacation, changing plans, and just to give us an idea the impact that chronic pain can have. Seeing a lot of 365. I mean, and that just goes to show how prevalent and how what an impact it has on our patients. But let's kind of dig in a little bit deeper. We really categorize back pain in two main categories. We have the sciatica or nerve pain, and that can radiate to the leg. Usually that's due to a ruptured or a herniated disc pinching on a nerve, and it can lead to or result from back surgery. That is in comparison to something like mechanical low back pain, which is what we're focusing on tonight. And it's due to structural issues, and often an overlooked one is weak core muscles or weak multifidus muscles. There are few surgical options or therapeutic options. Surgery is rarely indicated for this type of pain. And if you look at the two x-rays at the bottom of the screen, spinal cord stimulator is, a well-known therapy to treat pain, and it's really helpful for that sciatica type pain, that pain that radiates from the back down the leg. The leads are placed in the epidural space in the spine. That is in comparison to the ReActiv8 leads, which are used to treat chronic low back pain, and that's placed on the outside of the spine without having to go in near the spinal cord and nerves and things like that. So tonight, again, we're here to talk about mechanical chronic low back pain, and approximately 2/3 of patients with chronic low back pain suffer from mechanical pain. So what do we do for this type of pain? Really, we're looking at time, rest, physical therapy, chiropractor, acupuncture, massage can be helpful. There's medications that people often use, anti-inflammatories, muscle relaxers, opioids. There are steroid injections and ablations, and these are good options. However, they oftentimes don't completely address the issue. This is kind of like silencing a fire alarm without putting the fire out. You are treating the pain, but you're not fixing the underlying issue. So, when we're talking about chronic low back pain, multifidus dysfunction could be the problem. It's commonly overlooked. It's a key stabilizer that supports the spine, and the brain controls those muscles involuntarily without you having to even think about activating them. Whenever there's an injury, you start moving differently, compensating for those things, and the brain actually stops firing normally to that key stabilizing muscle of the lumbar spine. And that causes an overload of other structures in the spine and chronic pain. It's often a difficult thing to identify because it's such an overlooked issue. So, why does multifidus dysfunction cause so much pain? We're here in East Tennessee, and a lot of us either enjoy camping now, or maybe when we were a kid, we enjoyed camping. And you can think about putting up your tent, and you have your tent poles, and sometimes there's a main one in the middle, sometimes there's overlapping ones. But either way, we know that when you're missing a tent pole, it puts strain on the other areas of the tent, and you're not having that appropriate structure where you can get a good night's sleep. You're kind of fighting the tent. And so similarly, whenever the multifidus muscle is not stabilizing the spine, you're causing stress and strain elsewhere. Um, this can be a chronic issue. It doesn't really respond well to physical therapy. And so that's where restorative neurostimulation really comes in to help reestablish the function of the multifidus muscle. So here's that cycle. Let's start at the top. You have an initial overload injury that takes the brain offline from firing to the multifidus muscle. And as the saying goes, if you don't use it, you lose it. And so what we see on the MRI to the right is that the multifidus muscle is actually becoming infiltrated with fat instead of, normal healthy muscle. This leads to altered neuromuscular control, muscle dysfunction or atrophy, like we mentioned, and that's the pain cycle, and it just kind of repeats. So if you look to the right on that MRI, you see normal, healthy, dark muscle. But what's circled here in the subsequent pictures with red is that you can see the normal, healthy muscle is now becoming infiltrated with that bright white fat. And that's what we're seeing whenever patients are having this issue with chronic low back pain. So, what is life like whenever you have multifidus dysfunction? So, usually patients have issues with bending, lifting, twisting. So, picking something up can be very challenging. Changing positions. So, oftentimes patients will say getting in and out of a chair or out of the car. Those types of transitions can be very painful. Everyday tasks are a challenge. So, things that you normally wouldn't think about doing are becoming a major problem. So, vacuuming, standing, brushing your teeth at the sink. Patients often say they have to lean forward or support themselves. Issues, mowing the lawn. I clearly don't mow the lawn because I had a hard time remembering what that is. All right, moving along. So, just because you have multifidus dysfunction doesn't mean you can't also have other issues going on and be a candidate for this treatment. Oftentimes, that overloading of the spine can lead to these issues. So, In the studies, patients also had disc degeneration, facet arthropathy, disc bulges, modic changes in the vertebral spine. You can see inflammation or signs of damage there. Grade 1 spondylolisthesis, so slippage of the spine, not necessarily severe slippage. That would be kind of a surgical correction that would need to take place, but a slight slippage, can be present, or degenerative scoliosis. So again, we don't want to just turn the fire alarm off. We want to put the fire out. So our old or usual treatments are focused on palliative treatments, so things that cover up the pain. So medications, like we talked about anti-inflammatories, that those can have issues tearing up people's stomachs, not good for the kidneys or heart, kind of long term. Side effects from muscle relaxers or opioids, the sleepiness, dizziness, constipation, those types of things. And then the temporary nature, that injections, ablations, and then the peripheral nerve and spinal cord stimulators focus on covering up those pain signals, not treating the underlying cause. And ReActiv8 is a restorative therapy. It actually recovers that muscle and reactivates that muscle, and that results in functional improvement and pain reduction. So the ReActiv8 placement is placed in the low back. There are 2 leads that are placed, again, kind of outside the spine, along that transverse process in the lumbar spine, and it's connected to an internal pulse generator, or sometimes it's just called a battery. And usually we put it in the love handle or in the upper buttock, and it's a little larger than something like an Oreo cookie, or sometimes a case of dental floss is around that same size. And usually patients, it's not bothersome for patients. So how does it actually work? It's patient controlled. It's used for 30-minute sessions twice a day. Patients typically lay on their stomachs during their session, and we want that muscle to be activated during that time. And I'll let Rachel speak a little bit more about the patient side of things, but oftentimes people will say it feels like a massage or a pleasant sensation. So let's kind of recap what we've gone over before we get into some of the data. So what does ReActiv8 do? It stimulates the multifidus muscle, which is a key stabilizing muscle of the lumbar spine. And whenever there's an injury or chronic pain, the brain stops firing normally to that muscle. And so it's, if you don't use it, you lose it. And so the fat kind of takes over instead of the muscle. How does it work? It stimulates the muscle to contract, kind of like going to the gym every day, kind of twice a day situation, to wake that muscle up and rehabilitate that muscle. ReActiv8 is different than other types of stimulators because it's not blocking pain signals. It's actually restoring the function. Just like whenever you go to the gym, you're not going to see results if you hit and miss. You need to use the device consistently. So skipping sessions, or if you stop using the device, you may, kind of lose your progress or slow your progress. What to expect? Most people notice better movement and function first, and then their pain relief starts somewhere after, usually around the 6-month to a year mark, but sometimes progress continues up to 2 years out. Okay, let's get into some numbers and facts and figures. ReActiv8 is the most thoroughly researched neuromodulation therapy for mechanical chronic low back pain globally. There's been more than 4,000 patients implanted with ReActiv8 worldwide. 5 clinical studies have been conducted across Australia, United States, and the UK and Europe, with a total of 567 patients. So long-term clinical outcomes, we're really excited about this because we oftentimes don't get out to 5-year data, but let's just look at 1 year. 52% of ReActiv8 patients reported pain resolution compared to those receiving optimal medical management. And those are the things kind of on the palliative side that we talked about earlier in the presentation. At 5 years, patients are seeing progressive and long-term improvements. And so the graph at the right at the top, that's VAS score or pain reduction and what patients rate their pains. And they are seeing a 50% average decrease in pain that's sustained out to 5 years. And what's even more exciting is that their pain isn't just getting better, but their function is getting better. So we're looking at the Oswestry Disability Index at the bottom right. And the higher the number means the patient is not doing as well functionally, and the lower the number, the patient is doing better. And so patients reported a significant decrease in disability over time. So theoretically, if we're giving you, let's say, pain medications, we can get you to be pain-free, but theoretically, you might have side effects like those sleepiness, dizziness, constipation. And so that's the downside to those types of therapies. And what this does is actually fixing the problem, and we're seeing an improvement in function. So patient satisfaction data, at 1 year, 76% of patients were definitely satisfied. At 1 year, patients reported their low back pain felt more than 50% better. 72% of patients reported a significant improvement in pain or function. At 5 years, we're seeing even more patients that are definitely satisfied, 88%. 78% of patients reported substantial improvements in pain and or function, and then almost 70% of patients voluntarily eliminated or reduced their opioid intake. We're not here to talk about the opioid crisis, but this is really exciting that patients are being able to take less medication and see improved function and restoration of normal activities. So as far as safety information, it is very favorable, especially compared to other implanted neurostimulators. Of course, there's always a risk to a surgical procedure, bleeding, infection, and all of those things are mitigated by patient selection as well as surgical technique. And so we're always happy to tell you about your specific risk based on your comorbidities, but it is very well studied and a safe procedure. So just to recap, it is a safe, effective, and long-lasting treatment for patients with mechanical chronic low back pain associated with multifidus dysfunction. The results you're seeing are, unfortunately, they're not overnight, but fortunately, we're seeing long-term progressive improvement. So 6 months, a year, patients are doing a lot better. So patients that we select for this therapy have a long-term vision, a long-term goal of improving their function and getting back to the things that they once loved, that they're not able to do with their current chronic pain. And so this is not like an Amazon delivery overnight package situation. This is something where it's just going to take time. So again, is ReActiv8 potentially right for me? It's for patients with primarily mechanical chronic low back pain that's been present for over a year, back pain that's worse than leg pain, although some leg pain is okay because it may be referred. No pain resolution after physical therapy, or inadequate relief from those conservative measures that we talked about before. On the MRI, we want to see the evidence that the multifidus is infiltrated with that fatty tissue, and patients feeling restricted or unstable during normal movements. If the patient is a surgical candidate, we really don't want to offer this. If they have something that needs to be operated on, that issue needs to be fixed. If they have SI joint dysfunction, severe stenosis, or an unstable slippage. And again, for patients who've had previous lumbar fusion or lumbar spine surgery, it's usually not indicated. So we've looked at this MRI picture before, but I just really want to focus in on this because it's such an overlooked thing. And now that we have a treatment for it, it's exciting to be able to find this and offer this. So a radiologist normally won't comment on multifidus atrophy unless you're in severe grade. And so having your physician or scheduling a consultation for us to look at your MRI and your symptoms to see if it correlates with multifidus dysfunction is a good idea because it's so overlooked.
All
Okay,
right.
I'm going to hand it over to Darylyn and then to introduce Rachel because this patient experience is obviously very important.
Thank you so much, Dr. Schott. All right, so now we are going to get to hear firsthand from a real ReActiv8 patient named Rachel, and she is going to tell us a lot about her journey with her back pain and also her recovery with ReActiv8. Rachel, go ahead and take it away. You have the floor.
All right. Hi, I'm Rachel. So just a little bit about me. I am 41 years old. I got the surgery when I was 39, and I had injured my back originally when I was in Iraq at 20 years old. I'm prior military, just retired, and in Iraq, I was a 50 cal gunner in the turret escorting convoys, and I was turned around backwards because I was the last gunner, and I was sitting in a strap, and then my low back was on the metal of the gun truck, and then my bulletproof vest was above the metal of the gun truck, and we went from 60 miles an hour to an immediate stop. And so the top half of me swung back with the vest, and the lower half of me swung back, and my lower back stayed in place. And so that's how I originally got injured. And it was only two minor bulging discs, no nerve impingement. And then over the years, it atrophied, degenerative discs, where it just continued to get worse. I did teach hand-to-hand combatives, which is like jiu-jitsu, and it that injured me a lot worse. There were a couple car accidents in there that injured me worse. But I was managing with medication, and I even went a few years without opioids, and I was doing okay. And then I was doing chiropractor. I did the massage therapy. I did the ablations. I did what else? Oh, the steroid injections and just about everything that we all do in order to help with chronic low back pain. It helped for a little while, but then at some point, when the ablation wore off, all of a sudden my back pain went from 0 to 100. And I was maybe 36 years old, and all of a sudden I couldn't function. I couldn't do regular tasks. Everything hurt. I was in so much pain at all times. I had to get back on opioids. I went to physical therapy for 48 months until my physical therapist basically fired me and said that she couldn't help me anymore until I got a surgery or something else. And so I got fired from physical therapy. And then I went on, and it was so bad at the end point that I couldn't get to the restroom in the middle of the night when my opioids had worn off. I had to use the wall to walk. I had to get a toilet seat that was the super thick toilet seat because I couldn't reach the toilet when I would go to sit down. Um, when I would lean over to pick things up, my back would throw out and I would almost fall. And that was happening every time I bent over. I literally could not bend over to pick up anything. Um, and so that includes everything in my life. I basically stayed in bed at all times, bought a nice Tempur-Pedic mattress and just lived in my bed. And then stopped going out, stopped having a life, stopped dating. I couldn't clean my house. I couldn't do my job. I actually medically retired from the military. And it got really bad at the end. So I was actually referred to Dr. Chu in order to get a disc ablation. And when I showed up, he actually left the room and was like, hang on, I got to look at your scans. And so he went in, he looked at my scans, and he came back and he's like, I know you're here for this, but I think you're a good candidate for something else. And he showed me my scans, and they looked just like the pictures she showed. And it was, solid, good muscle that just slowly went to nothing but fat. And he was explaining the multifidus, I can't say the word. It's your lumbar muscles, basically. And so he showed me that all of that fat and explained that the ReActiv8 would strengthen and essentially turn my brain back on in order for my brain to activate those muscles. So by it, every time that it goes for those 30 minutes, it basically tenses your muscles and it tells your brain, hey, I'm here, use me. And so then whenever you're moving during the day, it actually, your brain will activate those muscles. Whereas before it had gotten shut off because of the injury and it wasn't using my muscles at all. So they'll literally, they can lay you on a table or they can do it standing up. They can do a test where they actually can see that your muscles aren't working when they should be and your brain should be using them. And they can do that before the ReActiv8 gets implanted, to know that you have this. But the ReActiv8 is, like she said, it's like a small, basically the size of a floss container that goes in my, it's in my upper butt cheek. And then there are two metal leads with wires that run to it in my lower back. And it doesn't hurt. I had the surgery and it was, I think, 8 weeks after. All like the only restrictions were bending, twisting, and lifting and reaching up. And it was because they didn't want those little leads, the little pieces of metal in the back to pull out of place. And so it wasn't any, bad restrictions. It was pretty easy. The surgery was light and it was fast. And afterwards, you had to lay on the good side, so you couldn't lay on the side that it was implanted. So that hurt a little bit, but it was actually a very easy thing to recover from. And then the biggest deal was it takes a long time to work. He explained very thoroughly, if you're not patient, this is going to be very hard for you because it'll take 6 months to a year for you to see progress. And I didn't care what he said. I was down to try it. I stopped him halfway through and was like, you can stop the sales pitch. I'll try anything, just like all of us, anything and everything that we can try to make us better, we will try. And so it, I actually started seeing improvement with, like she said, with actual function. So I could bend more, I could lift more, I could move better. I could bend over and pick things up again. And I saw that within 2 months. And then I actually started pain reduction around 3 to 4 months. And it started slowly at first, and then it was drastic. It was like I woke up one day and I had no pain. And it was absolutely, it's been like a miracle. I've reduced my pain meds multiple times and I'm actually ready to get off of them entirely. And it it has enabled me to do basically anything and everything that I want. I can now clean my house. I can move. I can do anything, as far as physical bending, twisting, lifting. If I bend too much for too long, like I'm now a locksmith. And so I was leaning over on the floor and installing a metal shelf with, doing screws. And I was laying on the floor, bending, twisting, and eventually my back did start to irritate. And so I stopped what I was doing. But as soon as I stopped what I was doing, my back pain went away. But otherwise, for the most part, I have zero back pain. And when I do things like that, normally you expect to be laid up for 2 weeks after. The next day, I'm always amazed because I don't actually have pain residual from doing certain activities that would normally really make my back angry. Um, I played pickleball. I actually lifted bins and lifted big plastic tubs and switched out my summer clothes yesterday. I pressure washed my house and the sidewalk yesterday. I was out there for 6 hours pressure washing. So yeah, I went from not being able to walk to being able to do basically anything and everything that I wanted. I've started dating again. I've started my social life again. It's changed my life entirely. And it's a very simple surgery. The risks are very low, especially compared to any other surgery. And yes, it does take time for you to see results, but it is worth it. By the time you finish physical therapy with them, you'll start seeing results. And I think it was only 8 to 11 weeks of physical therapy. And it really was life changing, and I highly recommend it for anybody that's out there that has chronic low back pain. That's all I have to share.
Thank you, Rachel. That was very compelling. I'm really,
Thank you.
really glad to hear you're doing so well.
Yeah, great.
So we have a couple questions. The first one that came in is, are there any age restrictions for the procedure or any BMI restrictions? Dr. Schott, do you want to take that one?
No age restrictions that are hard and fast. We really, and as far as BMI, I mean, kind of a similar thing. We're seeing patients of many different ages that are getting this therapy, and we're really individualizing whenever we're offering you this therapy. So we want to make sure that you're optimized. If you have uncontrolled comorbidities, things like uncontrolled diabetes, where your sugars are out of control, and things like that, that makes your surgical risk higher. And we do want to make sure that those things are controlled. But there's no real hard and fast age or BMI cutoff, at least at this point.
The only restriction on age is that it's not indicated for people under the age of 18. So
Yes,
as long as you're
I'm not
18,
taking care of pediatric patients. So, yes, that would be the one. I don't even see children. So,
other than that, there are no, there's actually, we did a study on older patients, and as long as you're a well-selected patient and it's appropriate for your exact situation, they don't do any worse than any other age demographic. Um, how long has the product been on the market? So we received FDA approval for ReActiv8 in the United States in 2020. So it's been, I think it was 2020. Now I'm second guessing, but it was like the early 2020s. It's been a few years. Um, what is the battery pack life? Is it rechargeable?
Mm.
yeah, so it's go ahead, Rachel.
Oh, I was going to say, so I heard 5 years, but I know that it can possibly go much longer. And that's where, yes, you do have to choose to either redo the surgery just where the battery pack is at 5 years or whenever it does die, or to get it removed. I'm going to keep mine and keep it as long as I can. But go ahead.
Yeah, that's exactly right. And you're not having to sit there and recharge it, things like that.
The first patients that we have heard about who've needed to have their battery pack replaced were like 10 years out from implant. Okay. Lots of questions coming in. Um, if you've had lumbar surgery or a fusion, is this treatment then not an option?
Yeah, if you have hardware that's kind of in the way of the device itself, that's gonna, not lend your anatomy to being treated with this. And so we'd have to look at your specific surgery, your specific operation. But if you've had a lumbar fusion where we put the device, then you're not a candidate.
Um, do the leads fuse in place like an SPSI?
So the leads scar in over time, and they're actually formed so that they hopefully don't move. There's little prongs that you can kind of see from the side, and there you can kind of tell them some of those pictures. But either way, that's part of why we don't want you bending, lifting, twisting early on in your implant phase, because we want a nice scar to form around the end of that lead so that it's less likely to migrate and things like that.
Um, this is a pretty specific question from somebody, but they said, my pain is pretty much in all of my back. So I know this wouldn't stop all of my pain, but any help would be amazing. Could I still be a candidate?
Yeah, that's worth parsing out kind of on a physical exam. Rachel kind of mentioned it, but there are specific physical exam maneuvers that we do that give us a clue about if the multifidus is contributing at least in part or large part to your pain. And so we'd really have to look at you, your symptoms, and your imaging and kind of put all that together in order to kind of best formulate your plan.
If you already have an SPSI installed, could you still be a candidate?
Yeah, if you have a spinal cord stimulator in place, you could potentially be a candidate still. We have patients that have multiple types of stimulators in place to treat different pains. Unfortunately, just because you have, pain in one location doesn't mean you can't have pain in another location, unfortunately. So.
Does anybody else have any other questions? What nerve roots are communicated to the brain and the muscle?
So this is actually treating the L2 medial branch nerve at the L3 vertebral body level. So we're not treating nerve roots, we're treating the medial branch nerve, but the goal again is not necessarily to stimulate the nerve, it's actually to turn on the muscle itself. And that does lead to a cascade of changes, with the brain kind of turning back on that normal communication. But again, the goal is to actually physically have muscle stimulation, not just neural activation, comparing that like to a spinal cord stimulator.
So there's now a couple of questions coming in about insurance. So I'll go ahead and answer that. Um, so there are a number of insurance plans that do cover this. Medicare is one of them. We also recently received a coverage policy through Anthem. I don't know if Anthem is particularly big in Tennessee or not, but Anthem does provide a coverage policy for this. But even if your insurance does not specifically have a coverage policy for ReActiv8, we have a really amazing patient access team that we offer complimentary, and they will take on the submission and appeal for ReActiv8, and we get people approved all the time. So it's just kind of one of those things where it may be a little bit of a fight, but it doesn't mean that your insurance will never cover it.
Yeah. That's what happened with me. I have TRICARE and they had to go and they went to TRICARE and got it approved for me and got it through.
That's right. TRICARE is supposed to cover it now. And then also through the VA, you can access it through the VA as well if you're a veteran. Um, okay, lots of good questions coming in. How does this differ from the Intracept procedure?
Yeah, so the Intracept procedure is a procedure that's done kind of more in the palliative category because you're treating pain from the vertebral body and disc kind of complex and that degeneration that happens there, where again, you're burning nerves and treating pain from that perspective. The ReActiv8 procedure is different in that what we think is happening is that you're treating the underlying cause of that degeneration and that cascade and kind of putting the tent poles back in the tent, so to speak, to prevent that further degenerative cascade.
What if you have a lock of disc that is gone? Is there a cutoff if you have none left in the lower back?
So my guess is that if you're asking about disc degeneration and your discs are just shot, this could potentially help you. Again, we'd have to really focus on your physical exam findings and put that together with your pain and your imaging. And so we'd really have to look at your specific case.
Yeah. I do have a disc that is completely gone and that needs replaced surgically, but it still helped me.
Is there any research being done for future modifications to treat other muscle groups along the spine? Mainstay Medical is not researching that at this time, to my knowledge, but Dr.
I'm
Schott, do you know
unaware.
of any other research?
No, I'm unaware of any other research. The other stimulators that are placed in the lumbar spine are typically to stimulate nerves that are peripheral nerves, and that's something with like a PNS type device, which is completely different. Again, the goal is not muscle contraction; it's nerve stimulation.
Do you know how many people have been implanted with ReActiv8 in Tennessee, Dr. Schott?
Oh, I don't know. Do you?
I don't know.
Tennessee specifically? I don't know.
Do you know about how many you guys have done at Pain Consultants of East Tennessee?
Probably between 10 and 20 is my guess, probably closer to 20, but I don't know actually.
Um, so we have a question about the evaluation process. Do I come in for an X-ray or an MRI or a consultation? What does that look like, Dr. Schott?
Yeah, so we can certainly see you and we'll evaluate your pain. And we don't want to order unnecessary imaging. And so if your physical exam and whatever imaging you have, we'll compare that to what we think is going on. And we do need to see an MRI with that multifidus fatty infiltrate. And so again, oftentimes the radiologists don't even comment on the health of the multifidus. And so we oftentimes need to go back and look at the images ourselves to determine if that's present and then correlate that with your physical exam findings and your pain complaints. So,
Um, would the implant be done at a PCET surgery center?
for yes, that's where we're doing them. Yeah.
That makes it pretty convenient.
Yes.
Rachel, can you talk a little bit about what it's like kind of living with the device? Have you ever had any issues with like TSA or anything like that?
So I did forget to mention, as far as the way that the device feels, in the beginning, I didn't listen to the technicians that were setting up my device. And they told me it needs to be at a comfortable level where you just barely feel it and it's something you can fall asleep to. Well, in my head, I figured if it's a workout, the more weight that you lift, the faster you get muscles. And so I made it go really strong and it hurt me to do it. And then because I did that, it made me not use it as often as I was supposed to, which made my progress slower. And so I finally went in and had them turn it down to a low level, which is where it's comfortable. I do fall asleep to it all the time. It took a minute for me to agree with the it feels like a massage theory, but now it does actually feel like a massage. Whenever I need to relax, if I have a headache, anything else like that, it actually helps me. So I'll turn it on when I'm not feeling well or anything like that, and it does. It relaxes you, and you can fall asleep to it, and it feels nice as long as you don't turn it up too high. As far as TSA goes, I've never had any problems. I've not even had to show my implant card. I just say, hey, I have an implant. They send me through the right x-ray machine. I'm good. As far as MRIs go, you do have to connect with a ReActiv8 member and they have to turn your device off before you go and get an MRI. But you can get MRIs, you can get x-rays. I've never had any problems with that. It doesn't hurt. The device that's implanted in my butt, the dental floss that's inside underneath your skin, it actually doesn't hurt. There are a lot of times I think touching it or laying on it or doing anything that has to do with it is going to hurt, and it hasn't yet. So that's, it's pretty good.
Rachel, how do you control the device?
So there's a magic wand, and basically it's a wand connected by a wire to another little box, and you put the little box over top of the device that's in your back or your butt, and then you hit the start button on the wand, and then it beeps 4 times, and then it turns it on. And well, it waits 20 seconds and then it'll beep, and that's when it starts, and then it goes for 30 minutes and then it turns off.
And you don't have to worry about it turning on by itself ever, right?
Randomly, no, you don't. It doesn't. They do give you an emergency magnet. So if there was ever a time where you needed it to go off, there's a stop button on the wand and it'll turn off immediately when you hit that stop button and have it over top of it. But there is an emergency magnet that will kill it if for any reason there's an incident where you need to turn it off immediately. Um, and it's small, it's easy to carry. They recommend you carry it with you if you travel. And otherwise, the wand stops it. So it's easy enough with that.
And can the patient adjust the intensity at themselves, or is that something you have to go into the clinic to do?
So you do have to go into the clinic to adjust the intensity. You can't change it at all. I will say if you move when you're doing it, it can adjust the intensity. It adjusts which muscles are being tightened. And so if you get in a really weird position or if you try to jump up and do something, it can be uncomfortable. It's not going to hurt you, but it can be very uncomfortable if you're not laying in that perfectly still, calm position. I can't lay on my stomach, so I lay on my side to do it. And I've even laid on my back sometimes to do it. So it really, you can do whatever position is actually comfortable for you. Because I know a lot of people with back pain can't lay on their stomachs.
Um, is the stimulation that's going on with the muscle group similar to what happens when you use a TENS device externally, Dr. Schott?
Yeah, so the TENS unit is again an external device, and so you are stimulating muscle, but it's those superficial muscles. Like we saw in that picture, the multifidus muscle is a very deep stabilizing muscle of the spine, and so that TENS energy is not reaching those deep down muscles. There are physical therapy exercises that can be used to strengthen the multifidus muscle, but again, if your brain isn't firing normally to those muscles, it's not going to be as effective. And then to actually regenerate that muscle over time, I mean, we're talking about 30 minutes twice a day. I don't know anybody that can plank for that long or do those exercises that are known to stimulate multifidus activation. And so this is truly a very different therapy than a TENS unit.
Would there be any waiting periods after the procedure with regards to like how much weight you can pick up?
Yeah, I think Rachel kind of spoke to that. Like 6 to 8 weeks is really what you're looking at. Again, we're really individualizing treatment and making sure you're healing properly. We want those leads to scar in place and not wiggle out. And so that's really the main purpose of waiting that period of time. But then after that, yeah, you can be cleared to even lift 50 pounds if you're there.
Um, will pain consultants of East Tennessee assist me in figuring out whether my insurance will cover the procedure?
Yes, yes. Connie is the one that I believe that usually takes care of that. But yeah, our team is certainly well equipped to get insurance approval and figure out if your insurance covers it. And like Darylyn says, they're happy to help as well.
If your back pain is also caused by arthritis, could you still be a candidate for this device?
Yes, arthritis, facet arthritis, disc degeneration, those slight slippages, things that happen can coincide with multifidus dysfunction.
All right, well, it looks like we answered all the questions that were there. If you have any more, go ahead and send them in really quick. So, if you want to talk to somebody like Rachel who has been where you are and recovered and did well with ReActiv8, Mainstay Medical has a patient mentor program for our ReActiv8 patients, and it's through a great platform called Patient Partner. It's 100% confidential and it's HIPAA compliant, so we don't even actually see what you talk about with your patient mentor. It's just an opportunity for you to learn more, ask all of your nitty-gritty questions, and have someone to kind of connect with for emotional support throughout the patient journey. A lot of people like to talk to somebody else, when they're just considering if they want to pursue a diagnosis through the process of the diagnosis, for encouragement during the insurance approval process. And then also too, when you're getting ready for surgery, but also even after surgery. So if you think you would benefit from something like that, there will be a link to this resource in the follow-up emails that go out after the presentation. Um, a couple more little questions. How often do you check it out? Like we like I'm
Yeah,
not
like pain medication management. We're usually seeing
okay.
patients about once a month. Um, we like to stay in contact and make sure there's no issues that are kind of falling by the wayside. For example, we've noticed that sometimes patients aren't using it as often as they should. So whenever we check in, we're checking the frequency of things. But if you are not on medication and you've had your implant, we could touch base a couple of times a year. It's not necessarily a month by month. We certainly want to see you more frequently early on in the implant process to make sure that you're doing well, you're programmed well, healing, scars look good, all of that stuff. But once things are set, you really are free and clear from seeing us. We're not going to be your ball and chain, I promise. And I just want to mention, Rachel, that we have some people that just want to say thank you again for sharing your story.
No, thank you.
There's one more question about what's kind of the predicted wait time from the initial consultation to actually being able to get the implant, assuming that I'm a candidate.
That depends on insurance a lot of times. And, it also depends on, getting our hands on records and imaging and making sure you've tried conservative measures that are appropriate to try before proceeding with a surgical procedure. And so, unfortunately, it just depends.
I did, however, I was in a rush because the military was starting my medical process to kick me out for the retirement for so that I could leave. And I had to get it done, and we got it done within 2.5 weeks. And that was from start to implantation. But it was a lot of work, and it was a lot of work on your team.
If you're somebody who has been getting treated for your chronic low back pain for a while and you've already had things done like imaging and you've already tried and failed physical therapy, then it will likely not require as much as somebody who your back pain has kind of just gotten unbearable lately and you haven't started any of that process yet. And if you are a Medicare patient, those approvals are pretty quick. Sometimes it's just a matter of being able to get the surgery scheduled. All right, well, before we go, the last thing we want to mention is just what's the best way to make an appointment with Dr. Schott at Pain Consultants of East Tennessee. Uh, you can go ahead and call this number, 865-934-2601, and speak to Darla, and she will be able to get you all set up for an appointment to get evaluated for multifidus dysfunction. And then once the team, has given you a diagnosis or ruled it out, then they'll be able to tell you what your next steps will be from there. Did I lose everybody? I don't see anybody else.
Uh, Somebody just asked a question.
I, Dr. Shaw, do you want to answer it? I can't see it.
Oh,
It said,
is the
yeah.
surgery done local or out of Knoxville? We are in Knoxville at Pain Consultants of East Tennessee, and the number there to call for an appointment. We try to make it easy for you to find us and to get in contact with us. But yeah, our surgery center is at that location.
And this information as well about how to make an appointment will be sent out in the follow-up emails that Pain Consultants of East Tennessee is going to send out. So you'll have that information in the future if you need it. All right. Well, if there's any more questions, Dr. Schott or Rachel, let me know. But other
Okay.
than that,
I think we've answered them all.
I
Thank
think
you all.
Thank
thank
you.
you. Thank you so much for joining us tonight, everybody. We really appreciate your time, and hopefully we'll be able to help you with your low back pain soon.